Before we address any of the items on the agenda, unfortunately, I must announce that Derek Cephas has voluntarily resigned as chair and member of the board. Derek was appointed by the mayor in October 2014 as vice chair and then chair. He led the board during a period of great reform and innovation in the New York City jails. This included the board's enactment of punitive segregation reforms, PREA standards, variances related to alternative restrictive housing for adolescents and young adults, and restrictive housing rulemaking. He has been an extraordinary colleague, chair, and boss. I know the board and the staff greatly appreciate Derek's dedication and commitment to the board and to criminal justice reform over the past 4.5 years. Because of Derek's resignation and because Stanley Richards, our vice chair, had a prior work conflict and can't be here today, that means we need another board member to get us through today's business. And member Jackie Sherman has graciously and generously agreed to chair today's meeting. Before Jackie takes over, I just want to point out that last week was National Correctional Workers Week. As we have talked about and as comes up often in these meetings, staff in the New York City jails have the most challenging jobs in the city, and I want to highlight this important week celebrating your and their contributions to New York City and its public safety. I know the board, and on behalf of the board, I want to thank everyone who works in the jails for their exceptional service to the city and daily commitment to improving the city's public safety and jails. And now we can move on to our scheduled business.
Good morning. Is that on?
Yes.
Good morning, and thank you, Martha. I'd like to first echo Martha's remarks regarding Chair Cephas's contributions and the commendation regarding the service of those who work in the city's jails. Our scheduled business this morning will start by voting on the draft March 12th board meeting minutes, which board members have received. Does a board member move for a vote to approve the minutes?
Second.
All in favor? Thank you. Martha will now introduce the public comment period.
So because of the board's proposed rulemaking and variance votes today, we have a public comment period now to discuss the variance and the new rule on the agenda, and to discuss the variance, and we'll have a separate public comment at the end of the meeting. First, DOC has requested a variance to allow them to reduce out-of-cell time to a minimum of 10 hours per day in the secure unit and to allow for alternative access to legal services and materials in that unit, and the board will vote on that request today. Next, and very significantly, the board will also vote to start a rulemaking process and public comment period on a new proposed rule. I'll briefly summarize that proposed rule now. In January 2019, board staff published a report which summarized data on serious injuries to people in custody and our audit of 3 months of serious injury reports. Our report documented 80% discrepancies between, that's me, sorry. Our report documented 80% discrepancies between the number of serious injuries diagnosed by CHS and the number of serious injuries reported internally and publicly by DOC. In response to these findings, the board planned to impose conditions on a long-standing CHS variance that allowed for the sharing of injury information between the agencies. Just prior to the February 2019 public meeting, the Corporation Council decided that the board's oversight via this variance was no longer required. That decision was based on his finding that the board's minimum standard should be interpreted differently than it had been for the previous 5 years. The board then unanimously voted on a resolution and passed a resolution saying it disagreed with the Corporation Council's opinion. The board also announced it would enter rulemaking. That leads us to today. That rulemaking was intended to enforce the minimum standards and implement additional rules to improve injury responses and prevention, which we found to be dangerously flawed in our January 2019 report. In March, The board submitted a draft proposed rule to the Law Department, Mayor's Office of Operations, and to DOC and CHS for their feedback on any operational impact. We've received that feedback and been responsive to it. We received the Law Department and Mayor's Office of Operations certifications last night. We then published the rule on our website and sent it to interested parties. The proposed rules seek a number of things. One, to expressly allow CHS to share with DOC specific diagnoses related to injuries sustained by people while in DOC custody. And two, to address the deficiencies identified in the serious injury report by requiring DOC and CHS to comply with data collection and reporting requirements concerning injuries. Additionally, in recognition of the fact that individuals in DOC custody are people first and the circumstance of their incarceration is not their defining feature, the board has made a commitment here to employ person-forward language in its standards and general communications going forward. To this end, the board proposes, wherever possible, deleting all references to, quote, inmates in favor of person-first terms, such as people in custody. Finally, under the proposed rules, CHS would be able to disclose certain individual communicable disease diagnoses when an exposure has occurred at a facility and it is necessary for CHS to engage in contact tracing to protect the health and safety of exposed individuals. When such disclosures are made, CHS would be required to inform the board within 24 hours. The board's vote to propose the rules today, if approved, will begin the public comment process as required by the City Administrative Procedure Act, or CAPA. We welcome public comment today, also in writing, via email, mail, or the city's rules website moving forward, and at a CAPA hearing scheduled for June 20th at 22 Reed Street. Details on all of this are on our website. We will publish the draft final rules in advance of a second board vote in July to approve the rules. For this initial public comment period, we ask that speakers limit their comments to these two votes and topics, and their comments to 3 minutes, and the board will have an additional public comment period on all other matters to close the meeting. The iPad on the stage will tell you how much time you have left. And we can...
Okay, I will call the first speaker is Mr. Craig. Okay. Jennifer Parrish, Ms. Parrish.
Good morning. I'm Jennifer Parrish, Director of Criminal Justice Advocacy at the Urban Justice Center Mental Health Project. I want to highlight some concerns with the secure unit, and this is based on the department's audit reports. First, regarding the law library. The department has failed to provide adequate services to the young people in the secure unit. The kiosks used for research were inoperable on December 28th and January 11th, and on January 18th, 25th, and 30th, the other days in January that were audited, all 4 of the kiosks were inoperable. In addition, the law library wasn't on the unit at all for 2 of the 4 days audited in November, and on 2 other days was there for less than 2 hours in violation of the minimum standards. Regarding lock-in, each of these reports asserts that young adults were offered all the lockout hours they were entitled to based on their housing phase. However, there were multiple audit dates when lock-in or lockout time was not recorded on some tours. So it's very difficult to understand how they came to the conclusion that everyone was offered the required amount of time when they didn't even document that in some cases. Also, in these units, for the individuals who are in phase 1, where they're only allowed 10 hours out of cell, very few individuals get 10 hours or even close to it. For example, in November, looking at the cases where the individuals were in the units long enough to be afforded all their hours, that means excluding people who were in court, only 3 of the 19 young people there had 8 or more hours out of cell. The conclusion that all secure unit residents were offered required out-of-cell time is also questionable because at other places in the reports, there were indicators that some individuals were not offered programming or out-of-cell time because they were afforded limited time due to security reasons. That should have been stated more clearly at the beginning of the report instead of buried within the individual accounts. For example, on December 4th, 2 people were only given 14 or 15 minutes out of cell due to security concerns. In other cases, the auditor specifically noted that the individual refused the time out of cell, for example, when it was only 3 hours and 48 minutes, but then in other cases where it was like 4 hours, they didn't make a notation, so it makes you wonder if they weren't offered those other 6 hours out of cell. And finally, it appears that very little, if any, formal education is taking place on these units. For some dates, the logbook didn't include the arrival and departure times to and from school, and most others, they indicated that those who were enrolled in school refused to participate. Now, while young adults aren't mandated to attend school, it's curious that most attended other program that's offered on these units, but did not attend school. I hope the board will look into these concerns and monitor them. I also support the board undertaking rulemaking on the issue of injury reporting and confidentiality and privacy. Corporation Counsel's unilateral misinterpretation of minimum standard 308 was unacceptable, and I'm very encouraged that the board is moving swiftly to address that issue.
Thank you very much. Danielle Gerard.
Good morning, Ms. Sherman, other board members. In addition to the concerns that Ms. Parrish has raised as staff attorney at Children's Rights, where our experience with adolescents and young adults in foster care and juvenile justice systems often brings us in contact with young adult and youth corrections policy because our clients are disproportionately represented in young adult and juvenile correction facilities. We also have concerns about the requested variances. The 2 requested variances that were on the agenda beforehand would restrict young adults to 10 hours a day of out-of-cell time and to the continued provision of legal services and materials on the secure unit. We would like to request that the Board of Correction deny these variance requests and instead require the department to comply with existing minimum standards. The secure unit variances for 18 to 21-year-olds have been extended by the board 6 times since November 2016, but social science and neurological research that guide best practices for working with older youth in foster care show that up to the age of 25, young people need developmentally appropriate services and connections with community. Young adults placed on the secure unit are cut off from the few existing normalizing activities available in detention, including access to the physical law library, school, and programming such as that available at RNDC. We remain concerned that young adults are spending too much time in their cells on the secure unit. As you know, with some exceptions, no prisoner shall be required to remain confined to his or her cell for more than 8 to 10 hours in a day, but young adults on the secure unit can spend 14 hours in their cells. This is too long for adults and certainly too long for young adults. In addition, by not allowing the young adults on the secure unit to leave the unit to go to the law library, to school, and to participate in programming, the department confines them to the unit itself, even when they are on lockout. We note that the secure unit compliance audit of March 2019 shows that of young adults housed on the secure unit in phase 3, many were out of their cells for longer than the 10 hours requested by the department. Granting this variance request would be a step backwards for those young adults and for the department. Just as punitive segregation is harmful and inappropriate for young adults, placement on the secure unit is also harmful and inappropriate for young adults. At least when they are there, they should be on lockout for the full 14 hours. Thank you very much.
Thank you. Mark Steer.
Hi, good morning. I'm Mark Steyer from COBA. I just wanted to know if anyone up there thought it was appropriate to send out rulemaking the day before a meeting and announce June hearing date, because the board has now more people on it, on staff, to do more work than ever before, and yet in the past, with fewer people on staff, you were able to comply with the law as opposed to jam things down. So I would like to know when we're going to see some rulemaking that actually protects the people who work in the jails, if that even is a consideration anymore, and sharing information about mental health diagnoses would be an interesting place to start with corrections professionals. And if you have any questions, please, I'm here to assist you, but you can't send something out the day before and expect us to sit back and actually be able to digest it and come up with comments. Thank you.
Thank you. I believe that's all the speakers.
So the next item is the proposed rulemaking. And as I discussed earlier, the board will vote today on the proposed rule. Sure. We sent out the draft yesterday, yes. But it has been published before? No, it has not been published before.
It wasn't published on Sunday with the normal rules that I get every Sunday from the city. So you may want to wind that back.
It was certified last night, and that's when we
At 7:44.
shared it. The public comment period, the vote today is to start a public comment period, which continues discussions with DOC and CHS and involves hearing from all of the interested parties over the next 60 days to inform revisions and inform any other improvements to the proposed rules. So anyway, that was just the opening for this part of the agenda, which we can now discuss.
Martha, could you describe the process, why it was delayed?
Thank you. I definitely appreciate the concern raised, and we thank you for letting us know about that, and that's something that we need to avoid. What I think is important right now, and Bobby, if you need to understand the process, that's fine, but what I think is most important right now is how material is this late, publishing of the draft with respect to the time that is allowed for review and for comment. So when I hear that we've got 60 days, there's a public hearing that will be scheduled. I just want to understand, and I am not at all discounting what you're saying, so please don't take it as that. What I just want to understand is how material is it? Do people have enough time? Have we cut off the time that people will have to review and comment to be ready for the public hearing? I think that's most salient, but we cannot ignore that we're putting things out with late notice.
Absolutely. And so we do have a longer public comment period than would be required by CAPA. We also, as a board, do not have to vote today. It's not required by CAPA. The way the board has operated in the past is to start a CAPA process with a vote. Voluntarily, the board has offered to vote to start the process. The vote that is required by CAPA has not occurred and would not occur until at the earliest July. This is the board's effort to jointly start a public process that actually is longer than is required by CAPA and the city rules.
So
Are there other comments?
Are there other comments on? So does a board member move to vote on proposing the rules as published on the board's website? Does any board member second the motion?
Seconded.
I'd like to open the floor for debate and discussion. Also, just to underscore that this marks the beginning of a process where there will be multiple opportunities for the board, the agency, and public discussion prior to finalizing the rule.
I think if we can just, for the record, just again establish what the timeline will be and what the opportunities for public comment for board review will be. Martha?
The public hearing is scheduled for June 20th. The estimated time for the final vote on any rule would be July 12th. or 14th, the second Tuesday in July. That's 2 months away.
I don't think it is on. Is it on? It is. All right. I also want to concur with Jennifer that I can understand how you feel that they were not given adequate notice. I also do know the rules and requirements of CAPN. We're not actually required to take the vote and manage it this way. We've tried to be as open and transparent as possible. And I also know, although I entered the room a little bit late because there was a track fire, so my train was held up, I do know that this has been urgent for the Board of Correction. It's urgent for us to be able to really track the serious physical injury and the violence in the jails. And so, notwithstanding the short notice, I do support it, and I do believe we'll be giving adequate time and more time than is required, so we can hear from everyone. Thank you.
Thank you, Judge. Are there any other comments? Then by roll call vote, I now ask board members to vote on whether to propose these rules and begin the CAPA process. Mr. Regan?
Yes.
Ms. Jones-Austin? Mr. Perino?
Yes.
Judge Hamill? Yes. Dr. Cohn?
Yes.
I vote yes. By unanimous vote, motion passes.
The next item is regarding the secure variance. And just to start the discussion, I wanted to summarize some of the key points found in DOC's recent public reports and audits as context and as background to this discussion. As of March 1st, 2019, DOC had placed 91 young adults in the secure unit. Since the board last passed a variance on secure in November 2018, the average daily population increased from an average of 8 young adults in November to 20 in February. The average daily population then decreased to 14 people in March and was 13 as of last Wednesday. The average length of stay for young adults exiting secure was 81 days. From September 2018 through February 2019, there were 31 exits from secure, which is an increase from 13 in the previous 6-month period. 32% of the exits were due to young people completing all phases of secure. 29% were due to movement to a less restrictive housing unit outside of secure, and 19% were due to young people being discharged from custody. Between September 2018 and February 2019, there were 72 placement reviews for young people in secure, which is nearly 3 times as many as there were during the last review period. Of these 72 reviews, 79% were recommended for progression, an 18% increase from the last review period. Since September 2017, the board has required that the department refrain from using restraint desks in the secure unit school area. Per the board's variance condition, restraint should be utilized only under extenuating circumstances, and DOC must notify the board on a weekly basis of their use. The department has successfully provided these weekly reports to the board, and the last documented use of restraint desks during school was September 14th, 2017. DOC's monthly audits of secure have shown the following. From September 2018 to March 2019, young adults in secure consistently spent less time out of cell than the minimum lockout. In phase 1, where the department must offer 10 hours of out-of-cell time, on average, young adults spent 7 hours and 4 minutes out of their cell. However, the department reports that the limited time out of cell is due to young people choosing not to leave their cells. The law library coordinator was consistently in the unit, and the coordinator spent on average 3 hours and 22 minutes each day in the unit, which is well beyond the requirement of 2 hours of law library each weekday. In other positive news, young adults are consistently participating in all programming afforded to them in the unit. When it comes to school, on average, 56% of students are refusing educational services in secure, and the audits don't document the reasons for school refusal. Students in secure who attend school spend, on average, only 56 minutes a day in the classroom. The audits show that DOC has implemented several of our recommendations since the last update, and we look forward to further discussions with the department about ways to improve these audits. And now I'll turn it over to the department to present the variance request. Chief Jennings, thank you.
Good morning. Good morning. And happy Mother's Day to all of you who are mothers. Thank you. Pursuant to 1-15 of the New York City Board of Corrections minimum standards, the New York City Department of Correction requests a 6-month limited variance renewal from BOC minimum standards, lock-in, and legal services for the purpose of maintaining the use of the secure unit. The department seeks that this variance takes place on May 23rd, 2019, the date upon which the underlying variance is set to expire.
Thank you. At this point, will a board member move to open the vote on the requested variance to allow the Department of Correction a 6-month extension of time commencing on May 24th, 2019, during which the department may provide young adults housed in secure units with minimum lockout time of 10 hours per day and access to law library services by means of a law library kiosk and typewriters in the secure units. Second. So now we'll move to a discussion. Do board members have comments? Dr. Cohen?
Since we're being asked to renew the secure variance, I just want to share with some concerns and complaints that the officers on the unit have expressed to me when I visited in March. Now, this shouldn't be news to the department because I know my executive director, I requested that an email be sent to you all, put you on notice so that you could, if these are accurate, they could be adequately addressed. And these were coming from a group of officers that the probe team was doing a search, so I had the luxury of being able to speak with a lot of officers. And these are the things that they reported to me, which not only goes towards safety for the people in custody, but very much safety for the officers. And that's our concern as well. And Chief, hopefully you can address some of these. The officers had represented that there was no steady afternoon captain assigned to the unit, and that for security it was really necessary to have a steady captain that really knew and understand the protocol, and the officers felt would have their back, so to speak. They also reported that they needed equipment, radios, cuffs, masks, and mitt. They also reported that lockout and lock-in times were being delayed because of the recent increase in the census, and reported that it's taking about 2 hours to lock everyone out, and that was cutting into the lockout time that the young people were entitled to. They also reported that the criteria for placement on the unit and for progression out of the unit was not being followed. They also reported that the mixing of the SRG groups is driving up the violence in the unit, and that school has been recently negatively affected because although there are different SRG groups that can mingle in the quad, they cannot mingle in the school area. The officers also reported that young people that have several incidences on the unit are not being transferred out, and in their opinion, were not suffering consequences of the violence that they were perpetrating on the unit. And that young people who had completed their phases, had served the time, were due to move, were not physically being moved, that they were remaining on the unit when they should have been off. Additional concerns and complaints of the officers is that young people complete their time. When they are eventually moved off, they're coming back, sometimes fairly quickly, and that officers, many of whom we spoke to that day, were very tired, saying that they were being required to work 16 hours, 2 shifts at a time, and they believe that that fatigue did not benefit the safety of the unit. And lastly, the officers, and this was pretty much unanimous, shared, other than the very newest officers, is that they were not receiving the benefits that were promised to them to go into the secure unit. These units are special units for which there have been incentives for the officers to be able to go, Gate 1 passes and hazard pay, and obviously, although they continue to do extraordinary jobs working in secure, there were a lot of concerns that were expressed. I know Martha King sent this email to the appropriate people, and there have been some responses, but it does appear that many of these problems may still be remaining. So, Chief, to the extent I realized I did not give you notice right before you spoke today about these, but to the extent you can address any of them, it would certainly be appreciated.
Yes. So, so in regards to one of your issues that you brought up, we were made notified that there were some issues with equipment. Bureau Chief Stukes did an analysis of all of the security equipment in GRVC, and one of the things that had previously been implemented was that the security equipment was to remain in the housing area, and that has since been reacclimated, and it's checked daily, and it remains. The second thing, the increase in the secure unit placements for the time frame in question has been for 2 reasons. The increase in inmate-on-inmate use of force incidents within the department involving the young adult population, and 2, the young adults with step-down placements from ESH from level 2 to level 3. All of the initiatives that were supposed to be implemented, I have not received any complaints about the staff not receiving their Gate 1 pass. I will look into just that. However, when you look at the secure unit and incidents, we're significantly down in that area, where this month we've only had 1 use of force and 0 fights. In itself, we had definitely not have an increase in those areas, and the officers there are required, or any officers required, to work overtime, and that's really about the needs of the department. So excessive amount of overtime? No, not at all. That has not existed. And with the school, we have not used any restraint desks in the secure unit school since 2017.
Is it true that the young people are not necessarily going to school because of the SRG groups and they can't commingle in the school, and therefore they're not being given the opportunity?
We have added adequate staff when we have to mix that SRG group within the school, but we have started commingling these SRG groups, and we have to maintain that, and they're going to get used to living together.
Okay, so I accept what you're telling me. What I would ask you to do is to further look into this. If you weren't on the email, perhaps that could be shared with you, and you could look into these. I think the fact the violence down really demonstrates the extraordinary training and commitment of those officers. Every time I go into the secure unit,
and they should be committed.
I am so impressed.
Absolutely.
So I hope that all of these issues have been resolved and that they are really rewarded for the hard work that they are undertaking. So thank you.
You're welcome.
Good morning.
Good morning.
I have always encouraged the department to build additional secure units because I thought it was one of your most successful models. Was a successful model for its purpose. But the physical nature of the current secure unit is horrible, and I think almost everyone feels that way. Most people in the room haven't seen it, or maybe you have, and it was my sense that the department, not my sense, I mean, in discussions we've had in this forum, that many in the department did not think it was a place where you could have a lot more than 8 people at any given time because of the design of the unit. It was designed for 32, but you realized immediately that was impossible. and that there is a there is a relationship right now between a lot of things, but certainly between violence and the population that's insecure, violence at RNDC and the population that you have insecure, lack of leadership at RNDC and the violence and population you have insecure. So I'm worried that that you had 20 people in that unit last month, and this month it's 13, at least as of.
Well, we're at 14 now.
We're 14. I'm sorry, it's 14 now, right? It was 13. It's 14 now. That's the number that we have, which is better than 20. But when the numbers are in the teens, as they have been for the past several months, the amount of number of people who sign up for education goes down, the amount of people who attend school goes down, the violence goes up. It's down now, and I'm very glad to hear that. What is your plans for keeping the? Do you intend to try to keep the population down? Do you agree? Do you think that you can have 20 people in that unit?
Well, Secure was designed for this most challenging young adult population, and while it's the goal of the department to keep the numbers where we can manage, but they are fully staffed up. We've also have ESH level 2, and we have an ESH level 3 now currently, and the goal is for RNDC, we've added another warden to that facility, DeWitt Caputo, who was very successful in the restarts at GRVC initially, and also with the reduction of violence and use of force for AMKC. We've also added 2 deputy wardens, the 13th of March, with a dedicated operation deputy wardens for the young adults. So we expect to see reduction. We've also met with DOE to talk about the increase in the participation in the school and the programming. So we expect to see a lot of changes. We allowed, when we put out a teletype in regards to commingling, for any inmate that wanted to be disruptive and did not want to participate in programming to go into pure young adult housing. So today, we have approximately 111 18-year-olds. 90 of them are at RNDC. And for the young adults, there are approximately 510 and 234 in RNDC. And biweekly, we're also petitioning all of the young adults who are housed in other facilities to see if any of them want to participate in educational services, and if they're willing to go into RNDC or GRVC, pure young adults, so that they can participate in the educational service and the programming areas. So there's a lot being done in reference to this young adult population. And it's one of the things that the Nunez monitor pointed out in the 7th monitoring report, and we're also looking to make sure that special attention is paid to this challenging group.
Just one small number thing. The number of young adults, you broke it up into 19 to 21 and 18? Or,
correct.
So the total is what of those
For the 18-year-olds, there's 111 total in the department, and 90 are at RNDC.
Yes. And then 530 something?
510 young
510.
adults, and 234 are in RNDC.
Okay. Well, I appreciate all those things you're doing. Something's happened over the past 5 months. If it's getting better, that's great. But the numbers are quite disturbing, and I'm not convinced that you can safely operate it at a population of 20 right now. And I'm sure you're trying to keep it as low as possible. But it is disturbing. We're engaging this in rulemaking right now, and so I don't know that we should do too much, at the time of this particular request for a variance. But obviously, comments saying that every 6 months we're doing this are understood, and the board is self-critical on that.
Yeah. Can I just follow up on that for a moment, since this cure is part of the young adult plan? So I just wanted to note a few things and ask you to address them. I mean, the monitor's report was really a stinging indictment of what's going on in city corrections. And with the young adult population being transferred to with the decision, which I still don't understand, why GMDC was closed after all the renovation, after the Peace Center, after the enhanced recreation, after all the special training of all the officers, of stable leadership, that was closed. The young people were dispersed. And now the Monitor is reporting that the term was violence has skyrocketed. So it would appear a reasonable conclusion might be that you had all the pieces in place in GMDC, and you don't in RNDC. We're starting all over building again and getting the officers, building the Peace Center, putting all of that in place. I also note that when Dr. Cohen and I went out earlier this year, we noted that there weren't enough officers. There was like one officer for more than 20 incarcerated persons. You're going to have a lot more violence, and we reported what the officers were telling us. So it does appear, my question is, has staffing improved? And do you think that that staffing has helped finally now to bring some of this violence down? And the last point that I'll make, and I see the commissioners here, and I hope you can address these concerns. I've been on this board for 5.5 years, and in my 5.5 years, there's been at least 5 or 6 wardens in RNDC. They seem to move through quickly. I loved them all, but my real favorite was Jim Perino, who then became the chief. And I think the instability in the leadership is a problem there. And so I'm wondering how you all might address that. I know you want the young adult plan to be as successful as we do, but obviously the Monitor's report, your own audits and ours, are highlighting a number of serious problems.
So I don't know how many times I have to discuss why GMDC was closed. It keeps coming back up over and over and over again. It was a decision made based on many factors, and I'm not going to reiterate them because we've discussed it both publicly in these meetings and privately in our meetings. So to keep bringing that up, I'm not sure what the point of that is. With regard to...
with all due deference, the point is now, because the Monitor noted the dramatic increase in violence among the young adults once GMDC was closed. That's the reason I'm bringing it up now, because it's related to the violence.
Well, I would disagree with your assessment of the Monitor's report, and Heidi Grossman will be talking about that in great detail once we get to that on the agenda, but that's not part of what Chief Jennings is up here to talk about. With regard to the leadership in RNDC and across the agency, we have experienced quite a few retirements in the agency, and I'm not going to fault anyone who's done 20, 25, and 30 years from saying, I've done my time and I'm going home and I'm going to enjoy the rest of my life. So those who have left have either retired or they've been transferred. We had Warden Presley go to Horizons. She followed the adolescents there. We've had a few staff turnovers, but we've had to have staff turnovers in other facilities as well due to retirements. So while we would like stability as well, that's what we're working on. Acting Warden Caputo is there now, and we believe we've built a good team around him. So RNDC is being retrofitted just like GMDC was with the Peace Center, and I encourage you to go visit the Peace Center. It's almost at its completion. And so closing a building doesn't make a program. The program makes the program. Staff make the program. So go down and see the new Peace Center. I was there 2 days ago, and it looks fantastic. The kids who have been participating in the programs down there have found that there's no difference between what was there and what's in GMDC.
So thank you very much. I also do want to just say this bit. I certainly support the variance. I support continuing the secure. And just so everybody's aware, the board voted to commence restrictive housing rulemaking. Secure is going to be a piece of this. This was a unit that was really devised by the Department of Correction under the leadership of Chief Perino then. I think in general it's a very good protocol, and we are continuing to extend it while we do the restrictive housing rulemaking, and we are in communication with you as well as a number of the experts before we have the CAPA meeting.
Thank you.
Thank you.
Are there additional questions, comments?
If there's no additional comments, we can move to the conditions. So I believe the board is prepared to vote on the existing conditions. These conditions were last approved by the board as part of the November 2018 variance approval. There is one change to the existing conditions that I can point out for the board members, and I can read that one change. It is to condition number 2 among the existing conditions. So the reason we're changing this condition is because restraint desks haven't been used in the school unit since 2017, yet the department has been forced to report every week that they haven't been using them. And so we're going to switch the condition to reduce the unnecessary reporting and make it so that the department would only have to report if a restraint desk were to be used. The new condition is that the department shall not use restraint desks in secure units except in the secure unit school area, and only when A, extenuating safety or security concerns or specific credible intelligence of a safety or security threat require their use, and B, the deputy warden of secure approves their use in writing. The department shall notify the board in writing every time restraint desks were used and specify the circumstances that required their use. The department shall provide written notice to the board within 24 hours of such occurrence. That is the change. Chief, do you have any comment, or does the department have any comment on that change?
No.
So it's the existing conditions with that change.
All right, and I believe that we are to vote first on all of the conditions that are unchanged, so conditions 1 and 3 through 11. Is there a motion for a vote on? Okay, thank you. Mr. Regan? Yes. Ms. Jones-Austin? Yes. Mr. Perino?
Yes.
Judge Hamill? Yes. Dr. Cohn? Yes. Thank you. Okay. Then we'll move to a separate vote on the amended condition read by Martha. That is condition number 2. Do I have a motion? Thank you. Mr. Regan? Yes. Ms. Jones-Austin? Yes. Mr. Perino?
Yes.
Judge Hamill? Dr. Cohn? Yes. Myself, yes. And so now we can vote on the variance with the attached conditions. Do I have a motion? Thank you. Mr. Regan? Yes. Ms. Jones-Austin? Yes. Mr. Perino?
Yes.
Judge Hamill? Dr. Cohn? Yes.
Thank you. So we'll move on to the next item on the agenda. Today we are presenting the most recent report from the board staff, which is on the topic of lockdowns in the city's jails. The report was published on our website last night. As background, the department has policy that permits its staff to lock down housing areas and facilities to investigate violence, to avoid violence, to conduct searches, and to restore order. During a lockdown, people in custody must be in their cell and all movement, services, and programming stop. Lockdowns, obviously, therefore hinder DOC's and Correctional Health Services' ability to meet the minimum standards. This has been a priority concern for the board in recent years. Last year, the board published its first review of lockdowns, finding that despite a 32% decrease in DOC's population, since 2008, there had been also an 88% increase in lockdowns. In response to our report, the department made a commitment in April 2018 to limit lockdowns to specific housing areas wherever possible, rather than locking down entire facilities in response to smaller scale incidents. In our new report, we are very pleased to document the results of the last report and the department's efforts and progress to limit the number and impact of lockdowns. This is yet another example of how the board and the department can use data to document concerns, strategize solutions, and also measure the impact of changes and the interventions we pursue. Building from the progress that you'll hear about today in greater depth, there's still more work to do to minimize the negative impact of lockdowns. The report further recommends today that DOC work towards ending the use of facility-wide lockdowns and that DOC use additional monitoring to inform strategies to further reduce the use and the length of lockdowns. So now I'll ask our Deputy Executive Director of Research, Emily Turner, and our Research Associate, Mackenzie Deary, to present a summary of the report's findings, and then we'll have an opportunity to hear from the department and for discussion.
Thank you, Martha. Good morning. My name is Emily Turner, and I'm joined with Mackenzie Deary, who led our work on this report. I'd like to start by thanking Mackenzie and the board's monitoring team for all of their work on the report. And I'd also like to thank the Department and Correctional Health Services for their careful review and feedback on our findings. We're very encouraged that the department has already agreed to implement nearly all of the report's recommendations, which I'll be presenting shortly. To develop our findings and better understand the department's use of emergency lockdowns and their effect on mandated services, our review involved reviewing the department's administrative data sources on lockdowns, including information from the department's incident reporting system. We reviewed DOC and correctional health policies related to lockdowns. We also audited 1 month of DOC and correctional health services documentation on the services impacted by lockdowns. And our monitoring team interviewed people in custody and correction officers to examine the impact of lockdowns from their perspective. Mackenzie will now walk us through our key findings, and then I'll discuss our recommendations.
Thank you. As Martha shared, from 2008 to 2017, the number of lockdowns in DOC facilities increased by 88%. But in the last year, the department has made really important progress. So in 2008, we found that for the first time since 2018, we found that for the first time since 2014, there has been a reduction in the annual number of lockdown incidents. From 2017 to 2018, there is an 18% decrease in the total number of lockdowns in DOC facilities, from 1,595 in 2017 to 1,313 in 2018. We also encouragingly found that the duration of lockdowns decreased from an average of 12 hours in 2017 to 11 in 2018. In reviewing the duration of lockdowns by housing area type, we also found that on average, people in general population housing were afforded 10.9 hours of lockout time per day, rather than the 14 required by the minimum standards due to lockdowns. When considering the leading reasons for lockdowns, use of force, inmate tension, and inmate fights were the top 3 reasons for lockdowns in both 2017 and 2018. It's important to note when looking at this slide that there can be more than one reason associated with a lockdown, so these percentages don't total 100. In 2018, a higher percentage of lockdowns were attributed to use of force than in 2017. In 2018, nearly half of lockdowns were imposed due to a use of force, compared to 36% of all lockdowns in 2017. Use of force. As Martha also shared, in last year's public board discussion, the department shared its objective of limiting lockdowns to specific housing areas rather than locking down entire facilities, and the data shows that they have made progress in this area. From 2017 to 2018, there was a 37% decrease in the number of facility-wide lockdowns, and in 2018, facility-wide lockdowns accounted for 12% of all lockdowns, down from 16% in 2017. DOC currently tracks on paper forms the services that are delayed or canceled as a result of lockdowns. We replicated last year's audit of these forms and reviewed all forms submitted in November 2018. In reviewing these forms, we found that in 56% of lockdowns, 6 or more services were affected, either delayed or canceled. But overall, DOC's documentation of these services impacted by lockdowns has improved substantially since 2017. The tracking on these forms was both more complete and more consistent with what was reported to the Central Operations Desk. However, the forms themselves do not capture critical information. Information that we would like to capture on these forms that would improve data quality in our general tracking and reporting is medical services beyond sick call, including clinic, medication administration and pharmacy, follow-up appointments, and specialty services. We would also like to know distinctly when incidents where no services are affected. Currently, there's no way on the forms to distinguish between incidents where no services were affected and forms that are just incomplete. We would be interested in tracking specific programming that's impacted by lockdowns, as well as the specific DOC staff activities that are undertaken during lockdowns. Currently, documentation doesn't include a description of what activities staff members must undertake to address the stated reason for a lockdown, so it's difficult to understand the number of staff or the length of time needed to address different types of lockdowns. For example, a lockdown imposed due to inmate tension as opposed to a use of force. This information could be used to understand the staffing impact of lockdowns, as well as whether staff activities are appropriately addressing the stated reasons for lockdowns. In addition to our quantitative analysis, we wanted to understand the lived experience of a lockdown. In order to do so, we conducted individual interviews with people in custody in housing areas that had been recently locked down. These interviews were intended to provide qualitative context and are not statistically representative of all individuals or people in custody who have experienced lockdown incidents. During a 2-week period in March, board staff spoke with 32 people in custody and 7 officers across 6 different facilities, and several key themes emerged from these conversations. I am going to break presentation rules a little bit and read directly from these slides because these conversations were really compelling. So overall, people in custody that we spoke to subjected to lockdowns perceived them as an unfair form of punishment for others' behavior. As one person said, "Our house is never the cause of the lockdown. Our last incident was 3 weeks ago. We shouldn't be burdened because of other inmates' behavior." People in custody also reported that the loss of human connection from the suspension of phone calls and visits is a detrimental impact of lockdowns. So one person said, "It's not a good feeling when you can't walk around or contact your loved ones who make you feel better when you're depressed. They get you through the day." Another person shared, "It impacts my family ties. They were mad they couldn't see me and they don't want to come visit anymore." Lastly, people in custody reported feeling less safe overall as a result of lockdowns. "Being stuck in the cell makes me feel claustrophobic. I know this is jail, but nobody helps us. I get really depressed and it's scary because no one comes and checks on us." We also spoke with correction officers in housing areas that had recently been locked down. Interestingly, they also expressed a certain amount of apprehension around lockdowns, reporting that they may feel less safe because they expect people in custody to be frustrated when they're locked out as a result of being locked in. One person shared, "At the end of the day, being locked in aggravates people in custody more, but they get over it quickly. In a big house, lockdowns cause more tension and more fights. There's nothing worse than having a full house and being on lockdown." However, the correction officers that we spoke with did report that they believe lockdowns to be an effective form of de-escalation. One person said, "Once they're locked down, there's less of a chance of an incident to occur. A lockdown is like a timeout. It gives everyone time to chill." In order to specifically understand the impact of lockdowns on medical and mental health services, as well as DOC and CHS coordination during lockdowns, we reviewed DOC and CHS policies and documentation of the services affected. Current DOC policy does not explain to which CHS staff the tour commander is required to communicate potential disrupts to health and mental health services during lockdowns, or within what time frame this communication is to occur. As you can see in this table, there are significant discrepancies between DOC security staff, DOC health affairs, and CHS documentation of how lockdowns impact health-related services. For example, in November 2018, DOC security staff reported that lockdowns affected sick call 104 times. DOC health affairs documentation suggests that lockdowns affected sick call 8 times, and the CHS incident log notes that only 1 incident where CHS staff were aware that sick call was affected. This suggests gaps in coordination between DOC and CHS and hinders an understanding of the impact that emergency lockdowns have on health and mental health services for people in custody.
So in light of these findings, our report makes a number of recommendations. First, we encourage the department to build on its recent progress and continue to reduce the number and duration of lockdowns to the fewest and shortest necessary to restore order and maintain security. The department should work towards ending the use of facility-wide lockdowns and instead use shorter, more targeted interventions so that only those housing areas that must be locked down are affected. This will reduce the number of people and services unnecessarily impacted by lockdowns, and the perception of lockdowns as unfair or excessive punishment. The department should develop a system to communicate publicly on its website when lockdowns impact phone calls and visits. Notice to friends and family about when lockdowns occur will minimize the negative impact on their relationships with people in custody and avoid wasted time in attempting to visit. The department should continue to improve its consistency and completeness of data tracking and documentation. This includes electronically capturing information on all services affected, as well as the impact on staffing. The department should collect and analyze information on the specific time, steps, and numbers of staff needed to address different lockdown procedures, such as those related to slashing versus searches versus fights, the intended goals, and track the intended goals of these activities. DOC should update its policy and outline the communication procedures and reporting timeframes between DOC security staff, DOC health affairs, and correctional health staff when lockdowns occur. Correctional health and the department should together develop systems to track how lockdowns affect scheduled services, medication provision, patients requesting sick call, and develop a policy addressing how access to care across different service types is prioritized and rescheduled when lockdowns occur. The department should provide the board with its updated draft policy on lockdown so the board can provide and share feedback on the new policy. Finally, the department should provide board staff with direct access to lockdown documentation related to the services impacted by lockdowns for review and monitoring by board staff. Again, we're encouraged that the department has agreed to implement many of these recommendations. Thank you.
No, discussion.
So good morning again.
Good morning.
So I just want to say that emergency lock-ins are a critical tool employed by the Department of Corrections in order to maintain and ensure operational integrity as well as safety of individuals in our custody and member of staff are paramount. We're at approximately 30 lockdowns, partial lockdowns, this month alone. We're projected to be almost 40% reduction from fiscal year 2018. Our overall emergency lock-ins have fallen by 18%. Their localized areas have risen by 6%. And we are in the process of revising our lockdown policy with some of the recommendations from the board as well as the monitors. And one of the things that we're doing, and we have been doing, we began back in January bi-weekly training for our assistant tour commanders and our captains so that we could ensure that that critical thinking is actually implemented in operating these facilities to make sure that services are reduced as least as possible so that there is normalcy within the inmate population and that they understand what the importance is to being an effective leader and supervisor. So that begun. We've also adapted some of our learning skills where we have managers that are going out for some leadership development courses, and we have embarked on a new transfer of learning in which the line staff are engaged as well as the supervisors so that we could show scenario-based training so that everyone would know the importance of making sure that operationally our jails are run safely.
Thank you, Chief, and thank you very much for the presentation, Emily and Mackenzie, and for all of the work the board staff did on bringing the report together. Are there comments, questions?
to go? I'll go first. Chief, just real quick, the numbers look really good, but what are we evaluating our success on? I mean, the department limited punitive segregation to historic levels, which is great. And to be able to separate some of these individuals, I don't think you have enough tools yet, and I'd like to see the department work on more tools to be able to separate them safely, the violent individuals. But, violence is going up above. I just don't want to, look at one number and say, great, and then you have your hands handcuffed because you want to try to keep that number low. So, is that impinging you and able to do your job? I mean, because, I wouldn't want you to be handcuffed and, I'm not going to lock this area down and more violence comes. I'm a little concerned that 6% of the lockdowns come from assaults on staff. I mean, that should be an automatic. As you know, someone hurts our staff, you got to lock it down before someone else gets hurt. But I'm sure that's built into the use of force, assault on staff also. So that number might be a little tainted. But, I just don't want to be a part of something where, all right, we're getting low, but, with the numbers in corrections going low and the most violent individuals being incarcerated, opposed to having a lot more people to be able to move people around, is this preventing you or, impinging you on being able to, run it the way it needs to be run? Because violence is very high, and, I just want to be a part of taking away a tool from you that you need.
So again, the tool is a critical tool. I would say violence is not on the rise. We have had an increase in our use of force, which is different than violence in itself. One of the things that we've done is for the first time define force in our new use of force policy. We currently have over 14,000 cameras coverage where we have staff that are looking at live monitoring daily, and we also have a layered versions of staff looking at incidents after it occurs. So we agree that our population has changed, where we have an uptick in our SRG risk groups inmates. We also have an uptick in our felony cases. However, what we are trying to do, and we have taken it very seriously and critically looking at it, that we're not going to discontinue the use. What we are doing is making sure that critical thinking and making sure that we get in there to address these issues more frequently and quickly so that we can restore normalcy.
Thank you.
Thank you, Chief, and thank you, Emily and Mackenzie. I don't have a sense, and I haven't heard from the department, that they feel constrained by the policy which says, when possible, lockdown a housing area rather than a facility as a way of thinking about it. And I hope that's the case. I don't think the department feels that we're considering this issue is something that makes the jails less safe. Is that? So
we have not locked down entire facilities. It's more about the localization of the incident and making sure that it doesn't carry out throughout the remaining part of the facility.
Yes, that's right, and I'm very supportive of and I think the department has done very important work in this area, which I believe does not make the jails less safe, but does provide access to programs. I mean, the reason that if you look at the numbers when they went up from 1,240 in 2014 to 1,618 and 15 to 1,849 and 16 to 2,685 and 17, then came down to 2,151 and 18. I mean, this is not real. I think these numbers suggest that increasing lockdowns didn't decrease use of force, and decreasing it did not increasing. This is just a good direction for the department to be going in right now, and I really appreciate its work and the board's support of it.
Thank you. And I wanted to identify something that I don't know that is exactly clear. The board, I know, followed the same methodology for this report that you did for the prior year, and I just want to clarify both for the board and for the public that the difference in counting of the number of lockdowns, I know, has been identified, that the department counts the lockdown events slightly differently, and we don't take issue with the board's methodology in that respect, but I do want to define for the board why that matters to the department, the manner in which we count a lockdown. So we count a lockdown, for example, if a lockdown began at 5 p.m. in a housing area, and the lock-in time for the overnight begins at 9 p.m. until 5 a.m. the next morning. So we would count the lockdown between 5 p.m. and 9 p.m., and then the lockdown, we've literally managed our operations and the incident reporting system. The lockdown is automatically lifted and needs to be reinstated, which is the chief's point about critical thinking. So previous to our electronic tracking of lockdowns, that actual event of lifting the lockdown didn't occur. And so people now need to consider at 5 a.m., as they approach 5 a.m., does the lockdown of this house need to continue? And if it does, then a new lockdown request is submitted and the lockdown in that house would continue. And that would be a new event for our purposes of count. And so I do want to identify that, we will continue to count our lockdowns with the, as individual events broken up by the automatic lifting of the lockdown during the afternoon count or the evening overnight. And that's operationally been a change for us over the course of the last year in the manner in which they're captured, which I think speaks directly, like I said, to the chief's point of that we are taking this seriously as an operation and a matter of approach to safety. And so, Chief Perino, I appreciate your concern expressed in that regard, but we are thinking really critically about the scope and the need for the lockdown, and in fact requiring our tour commanders and our wardens and assistant chiefs as part of our operational policy to consider the steps that have been taken to complete the lockdown or not, and then to reinstigate a new lockdown request as appropriate. And so I do think that's an important distinction in the manner in which the board uses the lockdown counts for the reporting purpose, but that the department will continue to count those slightly differently with the interruptions of overnights and lock-ins for the count.
Just thanks for this, Chief. And I can't agree with you more that you need this. And as you said, it's an important safety tool, right? It's incredibly important for everybody on the island. And I just want to thank the staff for doing like a really spectacular job here. The most important metrics in my view are the length of the lockdown. And I'm very happy with what you're saying. Not the fact that there's a lockdown. That's a command decision that has to be made by the commander on the field. The length of the lockdown, and then the metrics on services that are affected by folks not being able to go to recreation, go to the local library, go to state hall, and such. If that could be a management goal, it seems to me that that's a incredibly worthwhile endeavor. This group up here, you got to go lockdowns from that.
I appreciate that.
Thank you.
Chief, I wonder if you or a colleague could speak a bit more about efforts undertaken, new efforts to assure communication between DOC and CHS staff when lockdowns do occur.
Yes, so that's one of the things that with this biweekly training, we are stressing to the tour commanders of importance to make sure that that notification is made so they will be able to adjust their schedules for any inmate. And even during the lockdown, any inmate that has to go to the clinic is allowed to go to the clinic, or mental health services. Those services are not totally ceased for anybody who feels that they critically need to be there.
Thank you. Any further questions? Thank you very much.
Thank you.
Let's move on to the next item. I'll just start with a little background. In 2011, Legal Aid filed a class action lawsuit against the City of New York alleging a pattern and practice of unnecessary use of force by DOC staff with impunity. In 2014, the Southern District of New York joined the class action. In 2015, the case settled with a consent judgment. Among other reforms, the judgment required DOC to develop a new use of force policy, to take steps to impose appropriate discipline for staff engaged in misuse or excessive use of force, to improve staff training, and to install comprehensive video surveillance. The consent judgment provisions also included the appointment of an independent monitor to document and to report the implementation of reforms. And in April 2019, the Nunez independent monitor filed his 7th report. The monitor found that the department was failing to meet the 3 principal requirements of the consent judgment. 1, the reduction in the use of force rate. 2, timely and quality use of force investigations. And 3, meaningful and adequate discipline of staff for using excessive or unnecessary use of force. The report noted that during the monitoring period between July and December 2018, DOC's use of force rates reached their highest levels since the consent judgment went into effect. The monitor also found a high rate of force that was deemed avoidable or unnecessary. We've asked the department to update the board on the current status of the reforms and their efforts to address the monitor's findings in the last report. Thank you.
Well, I just want to thank the board for giving us an opportunity to present on the department's progress with respect to the Nunez consent judgment. While we would like to note that the department has maintained a high level of compliance with 84% of the terms of the agreement, that's about 264 of over 300 terms, where we've been rated either partial or substantial compliance. And while we are proud of our accomplishments over the last 4 or 5 years, we know we have a lot of work to do. We are not satisfied with where we are, and we know we have more, that we have efforts, we've undertaken efforts to improve and bring about the reforms that the consent judgment was designed to achieve. So as we know, the 7th Monitor's Report does set forth the significant work yet to be done. And while it does also acknowledge the commitment from our leadership, and without the commitment from leadership at the top, there's no way that reform can take place. And I think we're really proud that the monitor has acknowledged the commitment and that we have a very strong working relationship that allows us to bring about the change and the reforms and to even pivot to bringing about other reforms as needed where the terms of the agreement do not provide for that. So just a bit of context, over the last 3 to 4 years, as I mentioned, the department has really focused on over 300 terms of the agreement, and we've spent a lot of time developing, building, and creating systems that are the building blocks to sustainable reform. We have developed a case management system. We have a Nunez compliance unit. We undertake preliminary investigations that has seen a lot of success in our investigations. We really have brought about a great deal of transparency into the department, and the information that we have been able to identify and see has allowed us to actually target our efforts towards making the necessary reforms. And so what we see as the monitor focuses on these 3 items is that one key component of our success is that our staff at the ground level and our captains need to really understand what the policy means. And while we can develop a directive, while we can train the thousands of officers, we can refresh the training, understanding where there are needs to where there are issues that our staff are having and being able to then target and focus is where we're now poised to focus. And so sustainability is our goal, and what we're going to try to do is leverage what the chief has mentioned, our transfer of learning. We're trying to leverage that so that we can really focus on the core issues that the monitor has identified in the report. What we are also trying to do with respect to investigations is try to leverage some of the successes we've seen with the preliminary reviews and trying to take that and figure out how we can eliminate a backlog that has developed. So ultimately, all these systems is really designed to address the culture change that we need to see and address. So what I'd like to focus on also and note that while safety and well-being of our officers and the people in our custody is our highest priority, we are still dealing with decades of challenging systems. And this takes time to change. We are seeing results in some of our most challenging facilities, and that's because of the leadership that we believe has been promoted, and the leadership that we're seeing, this hands-on approach. And what we're trying to do is replicate the success that we have seen in some of our most challenging facilities. So for example, in the OBCC facility, we've seen some pockets of success, some great success there, where we have seen use of force decline at a great level. Use of force in the 7th monitoring period decreased by 34% through the last monitoring period. And we've also seen some successes in Rose M. Singer, where we have seen force reduced by about 23%. So our hope is, and our goal is to take the skill, the management style that has led to that success and try to replicate that. So moving more now into the specifics of the consent judgment in terms of areas of noncompliance on the use of force policy, as the chief had mentioned, and as I just want to emphasize and reiterate, transfer of learning is one of our key initiatives that we piloted and we are planning to roll out. This involves video roll call trainings. It involves a component of messaging, and a key component of this is mentoring by our mentoring captains. Staff are able to apply what they learn. We do this at roll call trainings, and our goal is to take units that address the 4 core areas that the monitoring team has identified, and during the roll call trainings, go over some units and ask questions about whether the staff understand. And rather than ask people and call people out during the training, do you understand this or not, we're trying to bring technology like clickers to see, does the group understand what is going on? And rather than identify as being a person that doesn't understand, if you have 30% of the group not understanding, then that tells the department that something needs to be done to address that deficiency. So that is something that we're trying to work out. And the 4 key areas that we are focusing on in our transfer of learning are what the monitor has identified as issues concerning painful escort techniques, the prevalence of inmate fights, the over-reliance on probe team responses, and the general reference to excessive and unnecessary force. So this is something that we're working on in terms of a schedule with the monitoring team about how that's going to roll out. I would also now like to turn to the quality and timely investigations reference in the consent judgment. So the department is actively working to eliminate facility investigations. That was, in terms of our preliminary investigations, we're seeing good success. The monitor has identified that facility investigations are lacking. And so what we're trying to do is centralize and bring the responsibility for facility investigations into our investigations and trials unit. But that, in addition, we have a backlog that has been developing. And what we're trying to do is take the successes and lessons learned from the PREA backlog and bring that into what we are doing here. And part of that requires us to develop what we call an intake squad. And as Deputy Commissioner Townsend has explained on various occasions, when you have investigators who are responsible from start to finish with a preliminary investigation all the way at the end to preparing a closing report, the time out in the field, it's very difficult and challenging to be able to complete all the deadlines on time. So what we've decided to do is develop an intake squad where we have people focus on the preliminary investigations, and then at a point in time when the preliminary investigation is completed, a case can take several routes. One could be that it's forwarded to another investigator to do a full ID investigation as required by Nunez. A second option is, after doing the preliminary investigation, there may be a need to just fast track that case, as we've explained before. there may not be a need to do a full investigation. You can fast track a case because you see from video evidence that there's really not much more to do, and it could be that we can negotiate an outcome, a disciplinary outcome with the staff member directly. Another track that it could be is that we close the case with no further action because as we've done the preliminary investigation, the video evidence demonstrates there's not much more to do. And then a fourth outcome may be that we have to close the case with a referral for a follow-up. Those are the kinds of cases that probably represent the largest number that we're anticipating. And those are not cases that would generally require full ID investigation under Nunez. So under those circumstances, it may be a minor offense, and that could be dealt with through a referral. An example might be a missing document, or maybe there were 6 officers and only 5 submitted a report. Now, I would also, and in terms of the intake squad, I just want to say that we presented this to the monitor, and we received initial approval to continue going forward and developing, so we're very encouraged with this, and again, looking to leverage the success we've seen with the preliminary reviews. So now moving on to the timing of full ID investigations. So this was, I guess, a focus on the statute of limitations, and so we are spending more time focusing on cases that are going to come upon their statute of limitations, and we're going to be tracking that. And I think also the systems that we're planning on building will hopefully focus on reducing the backlog and then give us the time that we need to avoid that circumstance from happening where we're running up to a tight deadline with the statute of limitations. On the quality and timing of facility investigations, as I said, we're trying to centralize, and I think what I just discussed will, in terms of our plans, will address the issues we have with the facility investigations. On the issue with discipline, while we have seen some good results with the trials and the trials division, what we recognize is with respect to command disciplines, we need to do a better job, and we are developing an audit protocol. It has been developed and it has been implemented, and with this new investigation structure, we believe that might resolve some of the command level issues, the command level discipline issues. And I would note that with this new plan, the idea is that we would also be able to authorize the Trials and Investigation and Trials Division to actually adjudicate some of the command disciplines. So that way it doesn't go back to the facilities and then delay the ultimate process of adjudication. With respect to the screening for assignment and discipline for special units, we have been, our plan is to continue to have internal meetings and have routine reporting, and we are optimistic that we will achieve compliance, where our goal is to achieve compliance or partial compliance in the next monitoring report. With respect to in-service probe team training and in-service cell extraction training, I would note that we are completing the recommended outstanding training, and that we are going to be tracking the training attendance, and we are developing a learning management system. That's in the beginning stages, so that will be helpful to track. I would note that while the monitor doesn't have reason to believe that we have not complied, it's our failure in being able to demonstrate the compliance, which is the frustrating part. We should get credit for the work that we're doing, and we need to do a better job of tracking that. With respect to facility investigator training, again, once we bring the facility investigations to trials, investigations and trials, then we won't really need to we won't need to train investigating captains. So that will obviate the need for that provision. With respect to the protection of young adults, as Chief Jennings has noted, some of the changes that we've rolled out at RNDC with respect to the leadership, I would just note leadership isn't based on a person. Leadership is based on developing systems and trying to groom people to become future leaders, because people retire and people can leave any day. And it's up to the department to really focus on professional development and leadership development so that we have our future leaders ready to take the mantle. So right now, acting Warden Caputo, as the chief mentioned, replaced Chief Gallagher. We have 2 new deputy wardens, and one of the deputy wardens, as the chief mentioned, is dedicated to the operations of the young adult plan, young adult areas. I would note that Caputo was very instrumental in the successes of Secure Unit at the beginning, so we're very encouraged and looking forward to working with him. And the next issue that I wanted to address is the adoption and implementation of direct supervision for the 16, 17, and 18-year-olds. With respect to the adolescents, the department's actively working on the STRIVE behavior management plan. At Horizon, we've been working with the monitor on that and with ACS. 18-year-olds, with respect to 18-year-olds at RNDC and et cetera, we're working on graduated sanctions, and we believe that will incorporate aspects of direct supervision. So with respect to use of force, again, identifying trends is critical, and knowing the information is critical. So we continue to use our immediate action committee to identify matters and use of force. Our wardens, our facility leadership also does rapid reviews, and we continue to use other systems like our early intervention unit as well. With respect to use of force statistics, as mentioned, some of our, given the problematic nature of our population, we're seeing that we have nonviolent offenders from our jails have been diverted, so that leaves us with more violent and difficult to manage people in custody. So the percentage of the population who have a violent felony top charge has increased to 22.7% from 16% in 2014. The number of gang-affiliated people in custody has nearly doubled from 8.2% of our population in fiscal year 14 to 15.4% in fiscal year 18. About 3,600 use of force incidents, about 61% from our total, involved individuals with an SRG gang affiliation. And then a significant number of our use of force, about 4,600 in calendar year 2018, involved people who are known to us to be in need of mental health. Notwithstanding, the stabbings and slashings that we've experienced have decreased by 42%, and the uses of force with serious injuries to either an officer or detainee during an assault on staff decreased from 63 to 47, 63 in 2017 to 47 in 2018. Most recently, between September and December, we've also looked at forces that did not result in injuries to the people in custody, and we found that a large number of them, of force that was used, were used to protect individuals from the harm by other individuals, meaning inmate-on-inmate fights. We call that rescue force. About anywhere between 81% and 84% of the incidents that occurred had no observed or claimed injuries to the people in custody attributed to use of force. And anywhere between 13 and 16% of the injuries were caused by another inmate, and DOC staff used force to protect the victim from further harm. So those are some of the efforts that are underway with the department in order to address some of the key concerns that the Nunez monitor has identified in the last monitoring report.
Thank you.
Thank you.
Questions? Dr. Cohn?
Yeah, my questions are for the commissioner, because she's responsible for this, but we'll see. First, I just want to read one paragraph from the report. The data presented in this section, which illustrates a discouraging picture, and the glacial pace of reform is difficult to tolerate. While the department must accelerate its efforts to implement the various strategies with fidelity, patients will also be required to assess their full impact. That said, until facility leaders, captains, ADWs, DWs, and wardens are fully invested in the spirit of reform, are committed to implementing the reforms, are recognized when their actions support the department use of force reduction goals, and are held appropriately accountable when they fail to act or act in ways that undermine the department's goals, the unacceptable pace of reform will persist. And this is in the context of this 7th report saying if it doesn't get better, we're going to raise the ante in terms of federal action. I'm not sure if they're speaking about a receiver, or I have no idea what they're speaking about. I mean, I don't think fines are going to help anybody in this project. So there's something else. But and I do appreciate, Councilor, that you gave us a response to this, which we've never heard before in this kind of context, and really appreciate the depth of analysis that you provided, which I think is quite responsive to many of the questions that I would have. But so that's the way I think the way that the monitor looks at this is he's giving with one hand and taking back with another. But fundamentally, he's saying this is unacceptable, and if it doesn't get better in the next 6 months, and we're already more than halfway there. He feels compelled to take action because your staff from the level of the warden on down have not agreed to this project.
Well, that's where I think in terms of what I laid out today and what has been discussed by the chief, by the commissioner, about our leadership development and then taking that idea of the transfer of learning led by our Bureau Chief of Operations, who came up with this idea. And we are really starting to see the beginnings of success. And that's where, as I said at the beginning, starting out in year one, when you're both first building the systems to have transparency, to even know what you need to oversee, is critical. And we're now poised to really focus on what's at the heart of what is trying to be achieved.
Well, I'm glad to hear that you have a plan for it. I hope it works quickly. I'm also want to say I was going to ask questions about painful escorting techniques and overuse of probe teams and overuse of headshots and other violent actions and failure to use de-escalation techniques. And I guess what I heard you say is that these are complaints, these are serious concerns of the monitor that you accept as things that you should be specifically addressing.
We do accept that we need to be addressing this, and our plan is to address them in our transfer of learning.
That's very good, and I hope to see that soon. On the negotiated plea agreements, this was an area where through your own discipline, through an agreed upon discipline process, you found in many, in 215 cases, some action had been taken which required discipline of an officer, and you didn't do it in all 215 cases. I'm just concerned about and then the monitor steps in and makes you do it. Why was it necessary for the monitor to make the department do its job?
Well, I think that we need to own what it is that we're responsible for doing, and that's, again, the systems that we're building are designed to address that issue. And our goal now with this new intake squad and trying to centralize the discipline and giving the authority to the Investigations and Trial Division to actually adjudicate the command disciplines and to try to, rather than send it back to the facility to allow further delay, our hope is that that is going to help bring about results. I would also note that so that is what my emphasis is. Okay.
And you comment on the 1,500 cases which are over the statute of limitations for civil service law, and many of these were the most serious. The monitor wrote that 240 of the 1,350 cases pending beyond the statute of limitations were cases that the monitor had selected for review because there was evidence of wrongdoing. Swift and certain. I mean, if you can't, when the most serious cases are going over the statute of limitations, that's a serious problem. And how did it get to that point?
Well, I don't know that I would agree exactly with what, in terms of how
I'm just
the
quoting
character,
from the report.
but I would say that the department needs to make sure that it doesn't allow the statute of limitations to run, and that we need to hold people accountable. On the command disciplines, what often happened was the trials unit would resolve and negotiate a command discipline, and so noticing that they needed to be implemented, we created a better system so that we highlight who it is that it needs to be done and that action needs to be taken so that it doesn't fall through the cracks.
Yeah, I would suggest that it might also relate to the first paragraph that I read, which is a failure of facility leadership being invested in this process. I want to talk now about ask questions. I appreciate the board's indulgence to me here on the investigation process. I mean, what the report says in the investigations is that analysis of evidence is often lacking. Issues of potential misconduct are often overlooked. Video evidence is disregarded or interpreted in a way that is inconsistent with the objective evidence of the video. And investigations do not consistently cite staff for incomplete, misleading, or false reports, especially those of secondary actors or witnesses. You know, as I recall, one of the fundamental issues that was resolved through the agreement was to separate people who were involved in uses of force at the beginning, not to have them write their reports so that everybody's report is exactly the same, so you could get So you knew that this is a critical issue. Could you respond to that the qualitative investigative failure here, which results in quantitative investigative failure?
Well, what I would say is that what we're seeing right now that I don't think we could have anticipated at the beginning of this agreement is that our preliminary reviews, our preliminary investigations are seeing a great deal of success. And the monitor has been very pleased with, as we've interpreted the report, with the level of the quality of these preliminary investigations. And so our goal here is to leverage that and try to identify the cases that don't require full ID investigations. That will free up our investigators to spend the necessary time to complete and investigate and complete the ones that really need to be focused on, where you need to go out and do interviews and you need to speak to many different people. So that's where we think the benefit of 3 of these years, where we've been able to build up and stand up a very good preliminary investigation system that no one could have anticipated would be as successful as it is now the way that we're planning on moving forward.
Well, I hope that's the case. I must just comment, as we've looked at PRIA and as I read this report and the last report and the report before that, either there's a competency issue or you don't have enough you didn't put enough in and you need more now. And I believe that you do need more based upon these numbers, but I don't hear that you say that you do, and yet these numbers are very, very high. So. We'll see. We'll see in 6 months, and you'll know now, what the numbers are. And finally, the report states, and I'll quote here, that the lack of stable leadership and the inconsistent assignments of housing unit staff produce a vicious cycle where both traction and continuity are elusive. Also notes, in the 38 months since the effective date, 1 facility has had 5 wardens. 2 facilities have had 6 wardens. In fact, as of the close of this monitoring period, only 2 facilities, Brooklyn House and VCBC, were operating with wardens who had been placed for even 1 full year. Similar changes are observed in deputy warden assignments and the support that accompanies each of these leadership positions. Now, the commissioner addressed a little bit this by saying that the issue is retirement, although I don't know I haven't reviewed the retirement data in terms of how that's working this year versus last year versus 5 years versus 10 years ago. But I wonder, this is a critical issue, I believe, as a former administrator, and obviously the monitor is very concerned about it. can these, the explanation that the commissioner has given to us so far today is that people retire, and let me just finish, and then, is there a need to modify the civil service rules in New York City and through New York State to allow the commissioner to hire in competent people at the warden level to meet this demand? I mean, it seems a serious problem to have this level of turnover within the facilities.
I would say that I think the focus for the department is on leadership development. We have our Leadership Academy, and the focus is on developing our uniform and non-uniform leadership. Always about professional development, always about doing better and trying to find opportunities for growth. We have our Deputy Warden program where we are focusing on classroom training, on the job training, and involving and introducing a shadowing component. We have our ADW pre-promotional where we're redesigning. We're doing we're taking a hard look at what's working, what's not working, and we're redesigning it so that we can focus on security, programming, administration. We're going to include classroom type work, simulations, again, on-the-job training. Same with our captain and pre-promotional training, doing the same kind of work. And they're our frontline supervisors, so it's very critical to focus our efforts on that. And especially with consistent implementation of policy, because that's where we get at the reinforcement of our policy. With respect to the non-uniform managers, we are also planning on development of training on managers and supervisors, where our focus is on collaboration, on team building, and skill building. And again, the Chief of Department mentioned the biweekly meetings with the captains and with our ADWs, again, reinforcing policy. I would also note that we have, we also work with outside consultants on leadership development. We work with the Moss Group. We work with Dale Carnegie. That involves a mix of classroom training. There's some action items, project problem solving focus, and coaching. And we also have a program at the John Jay School. It's an advanced certificate in correction management. It's a 2-year certificate program that's offered for our future leaders, captains and above. And we also have an individual by the name of Eric Williams who's come in to provide leadership and management training and a component on implicit bias to make people think critically. It's all about critical thinking, which is the theme that I think you're hearing from our commissioner and with the chief, is that we need to drill that kind of critical thinking all the way down to our line staff. And in addition, DCAS has opportunities for mid-level training. So I would say that we need to develop and focus on letting our staff cycle through all this really wonderful leadership development and groom our future leaders, because that's the only way we're going to succeed.
Well, I'll just finish by commenting that I've been involved in monitoring processes around the United States, and 3-4 years in, you're in trouble if you have not accomplished a lot. And I'm just telling you in terms of these very fundamental issues. Someone is thinking that they're waiting you out. I really hope that what you do, and that's what's going on right now. I really hope that what you describe will make a difference quickly.
Well, we believe that we're hopeful that the 84% compliance in most of the 300+ terms will now allow us the time and energy to focus on what's remaining, and we can give some deserved critical attention to those remaining issues. Thank you very much for the opportunity.
I know there are. I just had a quick follow-on question back to the discussion about investigations. And I just wanted to make sure that I understood the plan moving forward for the intake squad. Is that a reorganization, or does the department anticipate that there will be a need for additional resources to staff that new separate function?
Well, I would say it's a combination of both, and we're working on figuring out how we're going to achieve our, to carry out our plan and obtain the necessary resources to do that. So it is not within our existing. We need to also fill certain vacancies and in addition, work with OMB and others to make sure that we're able to come up with a way that we can achieve satisfy our plan and achieve our goals in the plan.
Thank you.
Yes, I have a couple of questions. First of all, I want to thank you so much for a really comprehensive report. I appreciate the update. I know my colleagues have covered a number of areas that I had questions about, but I did want to, you talked about some of the outside resources that you all are now utilizing for management and leadership. And I mean, it's very clear that you all have developed some excellent policies, protocols. You've been working with the monitor, the commissioner and her team, have certainly been working really hard. It would appear from reading the Nunez report, a lot of this is about operationalizing it and implementing it, which therefore is really about management and leadership, right? Not just executive staff, but all the way down. So I have a couple of questions. I recall when all this was going back on with Nunez and the Department of Justice, that McKinsey was hired by the city to work with the Department of Correction. Now, I think of McKinsey as having expertise in management and leadership. So I assumed that they were helping to work on management and leadership. So as you all started implementing this, you'd have those pieces in place. Can you share with us the recommendations that McKinsey made with respect to the anti-violence plan and the management and leadership piece in particular? Because that seems to be where the problems are right now.
I would have to get back to you on that. I don't have that information.
Okay. And the other thing that I would just raise is, you know, I know from having been an assistant district attorney and having been a judge that often those that are promoted are those that are really good at their job. It doesn't mean that they would be good leaders and managers. Some people have those skills intuitively. Others, you know, need to be taught or can be taught. And so I appreciate you say you're looking at the styles that seem to be working to see if you can train others on those styles. But that's where the expertise from leadership and management training would be really helpful, because what style comes natural to one person may not work for somebody else that you're promoting. So it sounds like you've got a lot underway to try to improve the talent development and management and leadership. I just want to go back to the piece about investigations and discipline. The investigations piece is obviously very critical because, and not only is it the investigation, but it's the discipline. It's the discipline that deters, the same way you ask for discipline for the people in custody. For those officers that break the rules, regulations, and the like, the discipline has a deterrent effect not only on them and on the future. So in light of what's in the Nunez report, what it raises for me is you all are law enforcement. Can you police yourself?
Well, I would say that a very robust disciplinary system is very important for any system. I can't disagree, but I think you can't just discipline your way out of a situation. You need to layer everything with training and development and leverage teachable moments. And that's where our transfer of learning comes in. That's where the work of was accomplished in OBCC using our CASC unit, where we're looking at video on a daily basis to see, are there procedural issues? Are there issues that we need to address in real time? Can we then communicate with the staff to let them know this is something that needs to be changed in real time? So it's not that someone's getting caught up in discipline, but they're actually seeing that we're trying to train and develop. We brought on a very large staff, thousands of officers who are that have been brought on to this department in the last few years. And you would expect that when you're trying to bring about culture change and you're trying to teach, that there are going to be moments with a very young force that we need to be mindful of that. And you can't discipline everyone and expect that everything is going to be different. This is about trying to train and develop. So, but that's not to say that we need to do a better job and do right with our disciplinary procedure.
Yeah, I'm not suggesting that you try to discipline your way out of it. And the training is very important. The monitor remarks that the reliance on retraining and counseling and the like is not sufficient to bring about the culture change. It's a culture change, right? There's been a culture of violence. You've achieved a great amount of work, but there's still a lot of work to be done. And much of this is in the implementation now. You've got all the policies, you've got all the protocols, but you have to get it implemented. And the same way you say about people in custody that they have to be disciplined because that has a deterrent effect. With all these open investigations and what appears to be a lack of discipline, there doesn't appear to be much in the way of consequences. So I would just suggest that you try to tighten that up in addition to all the management and leadership training and the training that you're doing with your officers. Thank you.
Any other comments, questions? Thank you very much. Today, moving to the next item on the agenda, we're also hearing from the department on recent initiatives to improve visiting in the city's jails.
Just as background, in 2018, there were just over 221,000 visitors to the city's jails and about 167,000 visits. Studies have shown that visits allow people in custody to maintain relationships with their family and communities, which in turn can result in better behavior in custody and reduce recidivism. And so we've asked the department to update us today on their new visit initiatives. Thank you.
Good morning, members of the board. My name is Stephen Kaiser, and I'm the Director of Policy and Reform Initiatives at the Department of Correction. Thank you for having me here today to discuss some of the department's recent work related to visits and visit reforms. Our goal at the department is to encourage visits by removing barriers that visitors may face to visiting and by implementing policies and programs that ensure visits are as meaningful as possible. As I begin this presentation, I think it's important to provide some context for visits in New York City. Around the country, looking at comparable correction systems, you'll notice that a lot of jurisdictions like Cook County or Los Angeles don't allow contact visits in any form. In other places, televisits are the only form of communication or visiting. But here in New York City, televisits are a supplemental resource that we offer to the population. And without a prior visit-related or a specific visit-related violation, all visits are contact visits. Further research on visits around the country is pretty limited. The research that does exist does make it clear that visits are incredibly meaningful and can have an impact on institutional conduct as well as reentry outcomes upon release to the community. Further, visits, particularly between parents and children, are particularly impactful, not just on the parent, but also for the development and the well-being of the child. I mentioned the research limitations because they've really pushed the department to engage with our community partners, with our staff, with the population, and with our visitors to inform our visit policies and procedures, as well as our visit programs. I'd like to give a special shout out to the visit working group that has been involved with the department over the past few years and all the members of the community who have participated and provided their insight and thoughtful feedback on our policies and programs through that group. I'd also like to say that all visit-related feedback the department receives through constituent services or through city information are provided to facility wardens and deputy wardens for further action where necessary. As Annie Penson, the Executive Director of Women's Initiatives, mentioned at a previous board meeting, women in custody receive fewer visits than men historically, and further, they receive fewer visits than men from children while in custody. In an effort to overcome these barriers, the department has taken a holistic approach to facilitating and encouraging visits for women. For example, the department created an additional staffing post, a uniform staffing post on the Rosie's visit floor that allows now mothers to enter the children's area with their children to play during their visits. Previously, children were only able to retrieve a toy or two before returning back to the regular visit tables. By doing this, we're allowing the mothers and the children to interact in a less institutional setting in a way that's more natural for a mother and a child, and we think the impact of that is incredibly important. Additionally, the department recently received approval from the SCOC to begin construction on a family visiting area at the Rosie's visit floor. This area will be located adjacent to the children's area, and it will have more family-friendly tables with more congregate seating and really allow the families to sit around and interact, again, in a less institutionalized setting without barriers. The department has also worked and is thankful to our partners at ACS for the expansion of the CHIP program at Rosie's. The CHIP program is the Children of Incarcerated Parents program. This is where children that are involved in the foster care system are brought directly onto the island to the facility where they engage in a 2-hour visit with their parents. During these visits, snacks and refreshments are provided. The children are able to run around and kind of, again, play with their parents and interact in a more positive, less constructed way. Previously, these visits occurred every other Tuesday at Rosie's, and now they're occurring every other Tuesday and every Saturday. The department is also engaged with another city partner, the Mayor's Office of Data Analytics, who are in the process of performing an analysis of visitor flow rate at Rosie's. Basically, the idea is we're looking for opportunities to expand visit experiences for women without increasing visitor wait times at the facility. And in 2018, in April 2018, the department partnered with the Children's Museum of Manhattan to offer a first-of-its-kind program, the Crafting Family Connections Program, where mothers are brought off of the island to the Children's Museum for monthly visits, where they're able to interact with their children for 2 hours. Again, snacks and refreshments are provided, and they can engage in programming and arts and crafts activities with their children during that time. We're very happy to announce that in addition to the 1-year pilot program that ended last April, we've extended the contract for an additional 2 years. And we look forward to continuing to work on that program and looking for ways to further improve and expand access. As a component of starting a first-of-its-kind program like that, we've also been getting a lot of feedback, not just from the women, but also from other jurisdictions across the country who are interested in replicating similar programs, and we've been working with those jurisdictions and providing our expertise in that type of program. It's very exciting for me and for the department to see much of this work coming into fruition and to hear the positive feedback we receive from families and the population, specifically the women. In addition to the work happening at Rosie's, the department has undertaken a comprehensive effort to address barriers to visits at all facilities across the department. This work is focused on beautifying visit areas, ensuring visitors have access to relevant information during the visit process, and reducing the time that it takes to visit, specifically on Rikers Island. The department completed renovations of central visits on Rikers Island. The renovations included repainting, reflooring, procuring new furniture, installing informational kiosks, as well as installing video monitors that play visitor-relevant information during the visit process. In addition to the access to information, we've also staffed 2 visit greeter positions, 2 full-time positions, one of whom is bilingual, and the visit greeters are able to kind of provide additional information and a friendly face to visitors during the visit process. In addition to the video monitors at central visits, the department also installed facility visit monitors at each facility visit area. These monitors play facility-specific visitor information for visitors during the visit process. We've also installed landline telephones that have call access to city information, to constituent services at the department, to the Board of Correction, and other useful resources to visitors during their visits. The department also recently contracted with a professional muralist who is in the process of painting large murals in all of the visit spaces across the department. Again, we're hoping that with the inclusion of this more color and more beautiful kind of artwork within these spaces, we'll be creating less institutional environments and encouraging both more visits, but also more meaningful visits and interactions. And to encourage visitors to bring children along with them on their visits, the department procured crayons and coloring books that are now available to children as they wait for visits, and that the children are also able to take home with them when they leave. With all of this work, we have to acknowledge the inherent inconvenience of visiting Rikers Island. It's not well connected, as we all know. And in April 2018, the department launched the free department visitor shuttle bus, which provides free transportation for visitors from 2 locations in the community, one in Harlem and one in downtown Brooklyn, directly to the visit area and back to the community. We're very excited about this program. We've seen a steady increase in ridership over the course of the first year, and we're very pleased to announce that in the first year of the program, the visitor shuttle bus provided 75,000 rides to visitors. That's in both directions. And as I said, we've seen a pretty steady rise, and we're hoping to see that rise continue. And to date, we've never turned a visitor away from the service due to capacity. And we've tried to be as responsive as we could to the visitors. Again, this is a program we started directly for the visitors. This is something we're doing for the community, and we've tried to be responsive to the visitors. We've removed the large decals on the side of the buses and replaced them with more discrete decals. And since the program started, we've doubled the number of buses in circulation on each route. The buses operate before, during, and after all visit hours where the department facilitates visits. Another critical component to visits at the department, in addition to the services, the physical environment, and the transportation, is of course the staff. The department is currently engaged in collaboration with the Osborne Association to deliver full-day training on customer service and community sensitivity principles. That includes implicit bias principles, and that training is available for all visits officers, for the shuttle bus drivers, and for the public-facing bell window staff. We successfully rolled out the first training this past Friday, and we'll be, completing the remaining trainings in the coming months. But the feedback we've received from the first training has been very positive. The idea of these trainings is to welcome staff and provide staff with the tools to, approach their work and approach visitors with empathy and compassion. To accompany that training, the department is also working with our training and development division to add an additional refresher training on the department's policies, visit policies, and procedures for visit staff. We're committed to building upon these efforts. We're far from done, and we're working to continue to improve our visit processes, procedures, and as well as our visit programs at the department. In October 2018, the department was awarded as a recipient of a training and technical assistance grant from the National Institute of Corrections and the Urban Institute, and we've been working with our NYC and urban partners for the past few months to further develop recommendations related to visits and improving our visit processes and experiences. We'll continue to keep the board updated on our progress of that work. The work I've described this morning has been a group effort, and it couldn't have been possible without the collaboration of our many city and community partners, as well as the hard work and incredible commitment to this work from our uniformed leadership and staff around the department. A meaningful visit has the potential to change an individual's life, and it's with that understanding and appreciation that the department will continue to further this important work. I thank you all for your attention and time today to this work, and I look forward to future opportunities to work together and further our potential collective impact. Thank you.
Thank you.
I just appreciate the work that you're doing.
Yeah.
Yes. Okay. First of all, thank you so much for your report, and I really commend the department on some of these terrific initiatives that are underway now. The visiting out at the Children's Museum of Manhattan is absolutely fabulous. Trying to increase the visiting for the children and all this is really, really terrific. Before I ask this question, this is separate and aside from what you've reported. People should understand that the role of the Board of Correction is to provide oversight and ask the tough questions. So I do commend you in all that's been done, but I do feel it's sort of incumbent to raise an issue that's certainly in the news now, and has been something that advocates have been calling to the board's attention for quite a while, and that has to do with the alleged illegal searches, strip searches and body cavity searches out at one of the correctional facilities. I know you can't speak about the particular incident, and everybody is presumed to be innocent when charged with a crime. But my question really goes more towards what is in place in terms of policies, protocols, management, and leadership to ensure this never occurs again. The reason I ask that is when we were in the process of visiting rulemaking, we heard allegations very similar to what now has been the basis for an arrest, which is probable cause, and an indictment by a grand jury, that these types of things were occurring. And even after we passed the visiting rules, there were still allegations made by advocates and lawyers that they knew of people that were subjected to these procedures. The Board of Correction has received complaints. DOI has received complaints. And yet this was allegedly able to occur. So I'd really like to, it kind of goes back to my question about being law enforcement, being able to police yourself, and how can you ensure that there really is compliance with your strip search and your policies that are in place for visitors. So, Commissioner?
So, correct. Everyone is presumed innocent, and we will wait for a court to decide what actually took place regarding the allegations in that complaint. We took that investigation and the arrest very seriously. Nothing that is alleged in that complaint is part of any DOC policy. And so we took swift action. One person had already retired prior to those arrests. The other individuals were suspended without pay. And so we constantly train on visit and search procedures. And I reiterate, none of what is alleged in that complaint is part of any DOC policy. We also responded to the DOI investigation. We've responded to their look at our policies and procedures, and we have adopted all of their recommendations. So we believe that everyone entering our facilities as a visitor should be safe, secure, and enjoy a productive visit. And so we don't tolerate staff misconduct on any level, and we will await the results of a court hearing on that matter.
Are you able to share with us any of the recommendations that DOI made that you had said that you've adopted and you're implementing to ensure that this...
I'm not sure if that report is posted yet publicly, but we can get you that information.
Thank you. Thank you very much for your response. I really appreciate it.
I have one question, and I would like to echo the praise for all of the efforts you have underway, you discussed today to increase visiting and improve the visitor experience. And my question is how the department is measuring the impact that the various efforts you described today are having, both on the overall number of visits and on the quality of visits.
Yeah, I think you kind of answer the question in some sense. A lot of it is looking at the visitor data to see how if we've been increasing visits and how the visitors have been using our various services that we've been providing. I think, so we've been doing analyses to see rises in visits. We've been weighing that against the reducing population. And we've seen kind of sporadic increases and declines in the visits. And we're trying to figure out exactly what is causing the spikes and lulls. So we are assessing it. We're working with the Mayor's Office of Data Analytics to perform a specific analysis of visits at the women's facility. And we're going to continue to partner with them and work internally to assess the impact of these programs. On the qualitative side, the feedback we've received has been very positive. We've conducted surveys specific to this at the women's facility. And where there's also work included to involve visit-related questions on intake forms that can then be used to track visits over time based on someone's initial kind of when they're entering their prognosis of whether they think they'll have visits or not. So we're implementing tools that will allow us to better calculate and measure the impact of these programs, but from the qualitative side, we're very encouraged by the feedback we've been hearing.
Thank you.
Appreciate your presentation. It was excellent and great to hear all the work that you're doing. I recently was contacted by a Culture Society, I'm sure that's one you as well, to expand the Brooklyn Public Library program. I have a question about Spanish-speaking staff, President of the Visit House. You mentioned that you'd hired some person. When we reviewed it a couple of months ago, that was an area that was present in some, but was consistently not present in others, at least on the days that we visited. Could you comment on that?
So the visit greeters should be there. There are 2 visit greeters at central visits. So the borough facilities at this time don't have visit greeters in that sense. But they're 2 full-time positions. I don't know the day that you were there, but they might have been sick or something like that. But they are there at the central visits house. I think we have staff who are able to provide assistance to Spanish-speaking visitors in the borough facilities, uniformed staff. and all of the forms that we provide that would be necessary for a visitor to fill out are available in Spanish and English as well as other languages as well. But it's certainly an area that we're looking into, and we'll consider, different things we can do to make our visits as accessible as possible to everyone, English speaking or not.
I don't know what I've dealt in situations where translators are other staff, and that's plus minus, of course. I don't know if it's within the city's labor rules to allow for requiring bilinguality as a characteristic for that post.
I just want to make one comment, okay? And I think that we appreciate everything in all of the board's recommendation as well as DOI. And Judge Hamill, to your comment, I think that we are more than capable of policing ourselves. And this initiative that we took on with allowing the inmates to visit with their families, the bus initiative, the public library, this is history. We have inmates who are now working out in the public. This is all history, where we've never, in my career, and I've been here for 30 years, that we've ever took on this type of challenge and transparency, and that we want to make sure that the inmate is actually returned to normalcy. So I don't want to downplay that at all. I'm not saying that we don't still have some challenges, but we do have the ability to see our shortcomings and address it, and this administration is committed to doing just that. So this is history.
Yeah, I just don't misunderstand me. I think a lot of the work that's been done under Nunez is terrific. I think this visiting initiatives are terrific. But the fact of the matter is you have a number of officers that have been arrested and charged with crimes as a result of illegally conducting strip searches and body cavities. Again, there is a presumption of innocence. It's allegations, and part of it appears to be, although it wasn't, certainly it's not a part of any policy and protocol, clearly there is a failure, was a failure in the system. And just one moment, and in management leadership. This was not new to us. I've been hearing about this for years. The Board of Correction had heard the complaints. The DOI had heard the complaints. So I guess my question is, how was it that this could have gone on without having been caught and stopped earlier? That's all. And I realize it's a huge bureaucracy, and there's a lot of moving parts, and extraordinarily difficult. But I have to admit, I was shocked when I read about these arrests and the indictments, and I thought, we've been hearing about this. So I guess I wondered, well, and I feel somewhat responsible that I didn't provide better oversight. If we'd been hearing about this, maybe there's something more the board could have done. So I'm not just faulting the department, I'm not faulting my colleagues. I'll take full responsibility, especially having been a sex crimes prosecutor. I know how humiliating that must have been to these women to come and visit. So that's all, and certainly that would discourage visiting. And I realize there's a presumption of innocence, but I think we all have to accept some responsibility here, because the allegations had been brought to our attention by lots of different people, certainly I've been on the board for 5 years, I've been hearing about this for years. And quite frankly, I kind of found it hard to believe. I'm like, that just can't be. Nobody would do it. It can't be. But not that innocent people get arrested and innocent people get indicted by grand juries. But this appears to be a very, very serious case. And I think going back to management and leadership and the issues that were raised in the Nunez report, it's related. And I know you all are undertaking a lot of steps to try to correct these problems. But in this case, if it's true, there's been some real serious injury done. That's all I'm saying. Otherwise, I commend that. But it is part of my role as the Board of Correction to provide that oversight. And these are things, in my 5 years on the board, that I've heard advocates and attorneys come in telling us. So I feel like it would only be appropriate for me to raise it since we're talking about visiting. That's all. Just we need to appreciate each other's jobs and our roles, okay? So we just need to make sure that whatever policies are in place, whatever the recommendations of the Department of Investigation are, that they're actually implemented. Because we saw in Nunez, there's a problem with implementation. Okay? Thank you.
Thank you.
Commissioner, I want to give you an opportunity if you wish to speak, please.
No, my only comment was your statement that if this is true. So let's let a court of law decide if this is true. I understand your outrage. You've read a newspaper report. You've read elements of what's been alleged, and so have I. And so we took action. We are training and retraining our staff. Your question, how could things like this happen? We have a huge organization, and 99.9% of our staff come to work every single day intent on doing a good job.
Absolutely. I agree.
And so there will be outliers in any organization. If this is found to have occurred, trust me, we will take more appropriate action. But we will let a court decide as to the facts of the case and what the final outcome would be. And I would appreciate those comments that you said, everyone is innocent until proven guilty, that you afford our staff the same courtesy. Thank you.
Let me just be clear, I do that, but the one thing is you can't hold up reform and policies to see once the outcome, you can't wait until the outcome is decided. We all know your jails are full of people who have been waiting for trials for a long time in this city. There's a backlog of getting cases to trial, which is part of the reason that it's difficult to manage the jails because of the backlog. So it's going to take a while to get that to an adjudication. But in the meantime, I wouldn't want to see policies not created and implemented, and proper supervision. If it's true, there appeared to be a problem with the supervision of the officers doing the search. Proper supervision. That's all that I'm suggesting, that they're absolutely presumed innocent. You have allegations, they're serious. Policies and protocols have to be created and put in place now to ensure what's been alleged in that case, as well as with many other women and attorneys, that doesn't occur again. That's all I'm
We're not
suggesting.
waiting to revise policies. Input from the board, input from city council, input from the monitors, all guide our daily practices, and we need to revise a policy. We certainly do that.
Thank you.
Thank you. We're now going to hear public comments, which will be limited strictly to 3 minutes per speaker. The iPad on the stage will let you know how much time is left, and I will let you know when your time has run out. In addition to or instead of oral testimony, we're happy to receive written comment, as well as phone calls, letters, emails, and website form submissions, or drop-ins to our office at 1 Center Street. The first person on the public comment list is Officer Harrison. Good morning.
Good morning, everyone. Let's address the use of lockdowns in order to restore the safety and security of all inside the facility. Let's come from behind the desk, from the Monday morning quarterback mindset. Put on the NYC DOC uniform. Come and work with us. Work for a month. Work on a tour. Find out what it's like, because when the cameras are rolling, we're going to be on our best behavior. It's like any child. I'll be on my best behavior because mommy and daddy's looking. But when mommy and daddy's not looking, I'm going to be who I'm going to be. We are concerned about, they're not going to court. We're holding them. What is it, care, custody, and care, custody, and safety? I'm confused at the moment because I'm trying to understand, you're worrying about what we're doing to the best of our abilities, but you're tying us up, not you per se, but you're tying us up with these, you're treating them unfairly. We get spit on, we get feces thrown at us, we get assaulted, but then you want to turn around and say, you're not giving them their services. We can give you everything we give you that we're supposed to give you, and we still get assaulted. And the first thing everybody wants to do is scream and holler that we did something wrong. Everyone's not perfect, but we always strive for perfection. So let us work together. We can turn around and say, you know what? I made a mistake. Own it. Today's day and age, nobody wants accountability. It's easy to point the finger. My mother used to tell me, when you point one finger out, 3 fingers point back. But everybody wants to point one finger out and never take accountability for self. Everyone takes accountability for self. Be a man, be a woman, be an adult. Take charge of what you say, take charge of what you do. And whatever comes out of it, it's yours. Own it. Thank you.
Thank you. Jorge Marin. Mr. Craig. Good morning.
Good morning. Let's talk about bad deals. I heard you talk about DOC entered into a bad deal with Anna Fusenberg and the federal monitor. It's not, people aren't leaving because they got 25 years. They're leaving because they have integrity and they can't deal with this. I've talked to several people that have retired in upper management, and one of the concerns was it was a bad deal made by Heidi Grossman. It was a bad deal made and officers are suffering. I've been reassigned to the facility, and what I've seen in RNDC is atrocious. You're not giving any of these people anything to work with. The whole mindset that we can, and it's not nobody fighting against reform, it was a bad deal. It's ridiculous. It can't work. So when you say, yo, it's not that nobody's resistant. You're not letting the uniformed staff run. This was made by a bunch of people who don't know anything about corrections, but know about laws and things of that nature. Nothing whatsoever. To speak to you, I don't even know what kind of judge you are. You put on a total front out here for these advocacy groups and the people that you advocate for, and that whole thing about guilty, then you're throwing in this guilty until proven innocent. Man, after you did all of that, how do you say that after that? Look, you're giving them no chance at all if they are innocent. And if they are, are you going to be big enough a person to sit up here and apologize? No, you're not. Because the same thing that you said about having responsibility, why aren't you responsible for the people that are getting cut and slashed and feces thrown on them? Where's your responsibility? I want to see you accept that. That's what I want to see you do. I've come here year after year after year and asked for assistance from damn near everybody in this room and haven't gotten any. You know, so now I'm going to do extreme stuff. You need to be responsible. You are responsible. They are responsible. It is ridiculous. Officers are getting beaten in their Superman outfit. When they put the uniform on, that's what you are. You are the law. If Superman got beat in his cape, what would happen to him if he was Clark Kent? Officers are terrified to walk the streets because they're being beaten when they are the law. And nobody seems concerned about it. Over and over again. So now I'm going to do something extreme. Now the media has to be known what I've witnessed over the last 4 months or 2 months since I've been back at RNDC. They cannot do this job. The managers that you speak of, they cannot do this. They're trying everything to meet a mandate that 2 lawyers sat in a room without any uniformed staff and came up with. So that nonsense that we're talking about, it's an atrocious deal. And they need to get out of it. That's what they need to do.
Thank you. Thank you. Winston Nguyen.
Good morning, everyone. I'm Winston Nguyen. Up until last Wednesday, I was a person in custody at OBCC. I know that an area of focus for the board is grievances and complaints and the way that those things are handled. I just wanted to bring the board's attention to the inmate counsel process. For most of us, inmate grievances are where we go for personal issues, and we're told on the form that if it's something that affects a group, you have to take to inmate counsel. The problem I see with this, and I was the board chair for the inmate council at OBCC for the time that I was there, is there's no accountability for that. The directive states that minutes should be posted from those meetings in the housing areas and the law library. Those minutes aren't posted. So when, like what Member Kwon was saying, with high turnover rates, if a deputy warden leaves, what was said before goes out the window. There's no follow-up with that, and that's what happened when we were there. Other things like the directive says that the commanding officer should attend a meeting the last Thursday of every month, bold and underlined personally that the commanding officer should attend. But at no time in the 4 months that I was there did either one of the two commanding officers ever attend. The problem I see with this is not just lack of accountability, but even for the officers, if one thing is said by one deputy warden, it doesn't carry on to the next one. So say you're the officer in the mailroom, one deputy warden might have said, oh, this type of underwear is allowed. Well, now another deputy warden is coming and saying another type of underwear is not allowed, or whatever the situation may be. There's lack of communication because minutes aren't posted or things aren't carried through. There's also a problem with, I'm going to be filing an Article 78 proceeding, but part of the requirement for that is I satisfy my administrative remedies, that I exhaust those. I can't do that, though, because the person who gives the final word for that is the commanding officer. And if all of my grievances are being told to be taken to the inmate council instead of the grievance process, and the commanding officer never shows up, how do I exhaust my administrative remedies if that person who's supposed to give the final word is never there? So I know that there's going to be another review of the grievance procedure coming up soon, I guess. I'm wondering if it's possible to also take some data as to how the inmate council directive is being run. How often are the meetings being done? What officers are present? How often is the commanding officer there? Which houses are actually represented by an inmate council representative? Is that process well known to the inmates who are there, that they have a representative? I don't know that the grievances that I've gotten returned saying that they were group grievances were ever inputted into any system. And I know that there's 3-1 is overwhelmed, but this might be a way of alleviating some of that, if that's possible. And I know I have 10 seconds left. Just on the issue of visits, I know that there's some question about the policies and procedures. In Title 40, it seems to say that the only searches for people coming in as visitors are supposed to be electronic devices. So maybe at some point some clarification could be provided for that, because it says only electronic devices in Title 40. But I'm out.
Thank you very much. Kayla Simpson.
Good morning. My name is Kayla Simpson. I'm a staff attorney at the Legal Aid Society's Prisoners' Rights Project. I am counsel for the Nunez plaintiff class. Thank you so much for adding that to the agenda today. It is maddening for me to sit and listen to the department cite 84% compliance as if the monitor has not described a catastrophic failure in the core goals of the consent judgment and what the state of things is described in the 7th report. And I don't think it's exaggerating to say that in that report, the monitoring team, who by the way represents a vast spectrum of correctional experience from around the country, a vast depth of experience, that they describe a human rights and health crisis of violence and staff-precipitated conflict. And I'll quote it. By any measure, the department is not meeting its obligations as the number of uses of force reaches the highest level since the consent judgment went into effect. Needless and gratuitous infliction of pain, chokeholds, takedowns, wall slams, OC, painful escort holds, which by the way are after an incident has concluded, simply to cause pain, overextending the shoulder or bending the wrist back just to escort someone after an incident is concluded and there's no more threat. The monitoring team remains very concerned that such actions on the part of staff are not being successfully addressed and remain largely unchecked, and at one point notes a cycle of violence, retribution, and mutual combat. That's what we're talking about here. And as was raised in discussion today, the report shows how much of the limited progress to date has been made only after significant and persistent pressure from the monitoring team. That disturbs us very much. And what do we hear from the department? Today it was, we have work to do, we're now poised to make real progress. That's little different in substance from what we have heard every time, and these problems aren't new. Problems in facility leadership and discipline, if you read the 3rd, 4th, 5th, 6th reports, you're gonna find those themes there. Respectfully, this is not the response of leaders facing a crisis who truly recognize the extent and severity of that crisis. And that's perhaps the most troubling part of all of that for us, the disconnect between the facts and the response, the tone that we see, the level of urgency. And we're not suggesting that anyone is taking this lightly, but the responses to date sound more to us like bureaucratic shuffling than a full-scale response to an emergency. And we also think, that there are tools and systems in place that they worked hard to develop, and we don't think they're utilizing even those tools. Discipline and leadership, to name two. And we heard a lot about commitment of leadership. But as a lot of the board members have discussed, leadership is about more than top leadership. It's about leadership throughout the organization. We are concerned to hear touting of early monitoring systems when the report showed us that many staff who were on monitoring were not even informed that they were on monitoring. And there was concern from the monitoring team that all the full spectrum of corrective action that's available to the department, like corrective, we're not just talking about termination or suspensions. We're talking about corrective interviews. We're talking about other forms of support and development for staff that are not being utilized. And I know I only have 3 minutes, and there's this very substantive issue, so thank you for your attention. I appreciate that. We'd be happy to talk with anyone interested about the more substantive suggestions that we have. But I just wanted to say that we need to see more action that shows an appreciation of the severity of this crisis. And we thank you very much for your oversight role and continuing to hold DOC accountable. Thank you.
Good morning, everyone. I believe that you have a legal and a moral obligation to protect correction officers. This week, 5 New York City correction officers were arrested. I won't go into discussing their case, something that is ongoing, but I will talk about the circumstances surrounding their case. The case against them is made by visitors, some who actually were caught and arrested for bringing in drugs, weapons, and other form of contraband into the jails. We have visitors who have found a loophole in the law and are about to make a hefty sum of money when the city settles these cases out of court. Visitors who have been involved in promoting prison contraband and found a way to get paid doing so. They argue that their rights to promote prison contraband has been violated by the correction officers. These visitors have found a loophole in the law and have no shame that they were arrested for promoting prison contraband. There should be outrage from the Board of Corrections and the department that someone could have such disregard for jail and jail safety that they get arrested for promoting prison contraband and go to the DA to complain that their rights were violated. There's something wrong when a person can be so brazen that they would come to a jail to promote prison contraband, get caught, come back, and do it all over again, then have the audacity to complain that their rights have been violated. There's something wrong. When correction officers are arrested, suspended without pay, and the bad guys who got caught take the good guys to court and is facing a cash windfall from the city of New York. These 5 correction officers who happen to be women no longer have an income to support themselves and their families because they did their job, which is to keep the jail safe. They fought like hell to keep contraband from coming through the visits and now find themselves having to defend themselves for caring too much. Their jobs as correction officers working in the visit is to keep contraband out of the jails. In 2018, the correction officers assigned to this facility arrested approximately 50 visitors for promoting prison contraband, such as K2, cocaine, heroin, marijuana, tobacco, money, razors, and scalpels. I believe it is the appointed duty and obligation of the Board of Correction, who are responsible for rulemaking and ensuring that the minimum standards are met and safer jails fall within that purview. Your appointed duty to approve variances when requested by those who you consider stakeholders, such as correction officers, who are the biggest stakeholders. What am I saying? We have something to do. If a person is caught bringing in or promoting prison contraband, you should not be allowed to visit anyone, and you should be automatically subjected to a non-contact visit. You should not be able to break the law. You should not be able to boldly bring in contraband and is suspected to be able to say, I don't consent, and have to come back another day and try again. Next to the Department of Correction, this board should know better than anyone the effects of prison contraband. You should be the champion of fighting against those who bring contraband inside the jails. You guys have a moral obligation.
Please wrap up your testimony.
Have a moral obligation. How do you help correction officers who have decided to fight and do the right thing to keep jails safe? Basically, bottom line here is this. I listened to you, Judge Hammond, and not one time did you address the visitors arrested for bringing drugs into this jail. Not one time has anybody on this board addressed the 50 or more visitors arrested for doing so. Not one time did anybody address the 350, almost 400 visitors arrested for bringing in drugs. You want to do something to help the policy? Then you don't have to change the law. You don't have to change the law in order to make these jails safer. You can simply make a rule. You're rule makers. You can make a rule that say, you get caught bringing drugs, contraband into a jail, you can't come and visit anybody in jail. And if you come here, you will have a non-contact visit, and you will automatically, immediately be subjected to a search, regardless of a consent. You don't have to change the law to do that. And that should be done to protect not only correction officers, but civilians and inmates. For all these advocates who swear to God that they love these inmates, why are you not outraged that visitors are bringing drugs into these jails and not being held accountable? This board should make a rule, ma'am. Make a rule.
Thank you.
Thank you.
Julia Davis.
Good afternoon, board members. My name is Julia Davis. I'm with the Children's Defense Fund of New York. I wanted to bring your attention to a couple of details from the annual lockdown report that really focus on the adolescents and young adults that remain on the island. While it's commendable that lockdowns overall saw some decrease, when you look at the data on RNDC, we saw a significant increase in the number of lockdowns for that community, going from 183 to 313, which was an increase of 71%. As we think about the way the board pursues continued oversight related to lockdowns, there needs to be a special focus on RNDC, the policies and practices that are operating there, and the young people that are there. Another key data point I wanted to focus in on was the fact that while overall there's been a slight decrease in the number of hours that people are subject to lockdowns, that's not the case for young people in RNDC. That remains at 11 hours. We've heard a lot about the use of force data. I'm very glad to hear about and watch and listen to the conversation today about use of force and the probing discussion around the Nunez report. But I think it's very important to understand the intersection of the use of force and lockdowns, which was highlighted in the report. The report indicates that almost half of all lockdowns are the result of use of force, and when we connect that with the findings from the Nunez report that use of force remains a driving concern, an unmet policy reform and practice change, we see that for young people to whom the department owes a special duty to provide robust, age-appropriate services which are consistently disrupted by lockdowns, We need to see these practices change. We need to make sure young people are receiving these services and aren't subject to conditions where they remain in their cells for excessive periods of time. With that said, I want to also note that providers of services to young people in the jails have been raising concerns around the issues of lockdowns, around the inaccessibility of services, the challenges with escort officers and having the number of hours to which they're entitled provided to them. That conversation is happening at City Council as well. So I would urge the department to, the board to continue to focus on these lockdowns as an area of inquiry and continued monitoring. And it's something that I think we in the advocacy community look to hear about the adoption of the recommendations that are set forth in the report, particularly as they apply to this population that has special needs and, again, are owed special duties with regard to the services and programming to which they're entitled. Thank you.
Thank you very much. The board's next meeting is scheduled for June 11th at 9 a.m. back here, and today's meeting is now adjourned. Thank you.